Waterloo Secondary School Alumni Association presents Our View for You, an informative series focused on you and your personal development.
Hi everyone, good day. I am Nandani Samuel, a registered dietitian of Trinidad and Tobago, and welcome to another episode on diet and nutrition. The month of September is dedicated to PCOS awareness, also known as polycystic ovarian syndrome. And in today's episode, we will be speaking about PCOS and the diet. I also have here with me a fellow colleague who would be joining me for this interactive session, so I would let him introduce himself.
Thanks very much, Nandani. My name is Josiah. Thanks for having me. I'm also a registered dietitian. Also, I'm a past student of Waterloo Secondary School. Actually, I graduated from Waterloo in 2014 when I completed my A-level studies. My purpose here today is really simple. It's just to share my perspective and knowledge on PCOS from a male's point of view. So Nandani, can you tell us what PCOS is about and elaborate some more about some common signs and symptoms?
Okay, not a problem. So PCOS, as I said before, it is polycystic ovarian syndrome. It stands for that. And it is a condition that affects 1 in 10 women of childbearing age, where there is an imbalance of hormones in the body and a higher level of male hormones or androgens are produced. So in some cases, it is also accompanied by cysts in the ovaries. So in terms of common signs and symptoms, the most prevalent sign would be irregular period or no period at all. And this is due to a lack of ovulation, right? Then we have something called insulin resistance. So your body would produce insulin, but it wouldn't be able to use it as effectively. And this could put you at risk of developing type 2 diabetes. Another sign would be apple-type body shape, where you would be gaining a lot of weight in the abdominal area alone, as well as some women may experience mild to severe acne, or even a lot of excessive hair growth, especially in the face and the body. Also, some women tend to experience things like male pattern baldness or thinning of the hair on the scalp, and a condition called acanthosis, which really stands for the darkening of your armpits, neck, or even underneath your breasts. And lastly, depression and anxiety. So these are some common signs and symptoms most women with PCOS would face. So based on your expertise and knowledge on PCOS, what are some complications, and probably I want you to highlight the diagnosis of PCOS.
Sure, no problem. In reference to PCOS, some complications that come with it or can come with it are infertility or just the inability or difficulty to get pregnant. Also, some women have a higher predisposition having a condition called metabolic syndrome. Metabolic syndrome is categorized of having some conditions like high blood pressure, high blood sugar, low HDL, high LDL, and even obesity. Women with PCOS even have a higher risk of developing heart disease and even stroke. Sleep apnea is something that women with PCOS also endure, and they even have an increased risk of endometrial cancer. With regards to the diagnosis of this complex condition, it can be diagnosed by women who have at least 2 of the 3 main symptoms, and these symptoms are having irregular menstrual cycle, high levels of androgens or male hormones, and even having small cysts in the ovaries. However, I must say that the presence of having cysts on the ovaries isn't always a key symptom, because not all women who have PCOS are accompanied by cysts on their ovaries. So when we are speaking about PCOS, we want to approach it in managing it via 3 ways. Firstly, we want to manage it via medication as prescribed by a doctor, of course. Secondly, through the diet with the assistance of a dietitian, and even exercise, right? When it comes to diets, right, you want to have a well-balanced diet. When I say a well-balanced diet, a diet consisting of the Caribbean 6 food groups. The Caribbean 6 food group entails staples, legumes, foods from animals, fruits, vegetables, and fats and oils. Now, I will just want to take some time to speak about some food combinations with regards to its applicability to us as Trinidadians and people in the Caribbean. Now, in our culture, we tend to have a lot of starchy or staple foods on our plate. For example, a Sunday lunch, for instance, you would have fried rice, you would have macaroni pie, potato salad, and all of these things are really high in carbohydrates. So,
Yes.
as a dietitian, I would love to recommend that you want to have a balanced diet or a balanced plate. And what this looks like for breakfast, for example, you're gonna have something from the staple food group, some protein-based sauce, some vegetables, and we always incorporate fats and oils in your cooking, right? So what this could be simple as whole wheat bread, right? Some boiled eggs, some cucumber slices, and you can even have a slice of avocado to go with that. A very, very thin slice, about 1/8 of the entire avocado, right?
Right.
And in terms of pattern, breakfast and dinner could have the same distribution of meals with regards to the 6 food groups. When it comes to lunch now, but we can have staples, legumes, a protein source from animals, vegetables. You can even have a fruit incorporated like a beverage, like 100% fruit juice. And as I said before, you can incorporate some healthy fat in the meal also, right? So moving on with some more dieting principles or dieting guidelines for women who want to manage PCOS, you want to increase your intake of high fiber foods. So high fiber foods are things like your whole wheat breads, your brown rice, your provisions, these things. You want to reduce the intake of refined carbohydrates, sodas, and even processed foods, right? Nandani, from your experience or even your expertise, what are some information you can share with the audience with regards to how much meals women should have with managing PCOS?
Okay, Josiah, so based on what you said with the Caribbean 6 food groups and trying to incorporate all of the groups into your daily meals, women should try to have at least 5 to 6 small meals instead of the 3 to 4 large meals. And what I mean by small meals, you having breakfast, a mid-morning snack, 2 to 3 hours after breakfast, that is, you would have like a mid-morning snack, then 2 to 3 hours after you would have lunch, mid-PM snack, then dinner, and probably a bedtime snack. So there's always that 2 to 3 hour interval. And for your snacking options, you could use the healthier options, such as simple fruits that is in season, or probably yogurt or nuts or so on. So, and other guidelines would be just to have healthier cooking methods. So we want to use methods like boiling, steaming, grilling, or even baking. And the last point would be to limit the unhealthier types of fat, which you mentioned before. So that would be like your saturated fats and your trans fats. You want to limit that. So like the cooking butters and so on. You want to also cut off the excess from the meats, as well, the excess skin from the meats, that is. And you would also want to reduce the consumption of fried foods. So I would like you to highlight some basic recommendations for exercise and just tell us how it affects insulin resistance.
No problem. Actually, studies have actually shown that weight loss of just 5% can lead to a significant improvement of PCOS. Exercise actually aids in the management of this condition regarding weight management and insulin resistance. Therefore, weight loss improves insulin sensitivity. According to the World Health Organization, it is recommended that physical activity should occur 3 to 5 days a week for at least 30 minutes to 1 hour in duration.
Right, so I am glad that you said that, Josiah, because it is important for women, especially with PCOS, to keep that healthy body weight. Right,
Definitely.
so I'm gonna put you on the spot. I just have a simple question. From a male's perspective, what would you do? Say, for instance, in future, your wife or your daughter, or even presently your mother has been diagnosed with PCOS. How will you approach this? Not just from a dietetics point of view, but being a male, what would you do? And based on your experience that you have seen at the hospitals, how would you deal with it?
That's a very excellent question, Nandani. Thanks for that. With regards to a male's perspective in helping women manage the condition, I will encourage the gentlemen out here listening to really give a listening ear and be sensitive to women who have this condition. This is a condition that unfortunately science cannot pinpoint what's the actual cause of it. The only information we have so far is that if someone in your family, a female, whether it's your mother or grandmother had it or has it, you as a female have a higher predisposition of getting it also. So women who have this condition, it can be very challenging to deal with alone. So we as men should be sensitive with helping women engage this battle that they are coming against. Especially women who have difficulties with becoming pregnant. It's a very touchy topic, especially with me counseling in the hospital. It's a very touchy topic with women, and having PCOS, it doesn't make it impossible, but it can make it a lot more difficult. So women, I would love to encourage you that you're not alone with this battle against PCOS, and as we strive to bring awareness of this condition, know that we as men would and should try our best to support you a lot more with engaging this challenge. And you young men out there, really give a listening ear, really be sensitive, really be understanding to women who are dealing with this condition.
I actually love the way you approach the question. It's being a woman myself, it is difficult to manage stress, and stress especially is another factor that plays a pertinent role in the management of PCOS because of the hormonal imbalance and so on. So having your spouse or probably just your family members being as your support system, it is absolutely good to have that type of mental support. So even if some persons do not have it, there's where we would recommend probably a psychologist, right? So thanks so much for answering that question. In closing, I would just like to say PCOS is a complex and overlooked condition with significant long-term metabolic risk factors throughout a woman's lifespan. So this is where diet and lifestyle will play like a pertinent factor or a key role in the management. So what I have to say is that helping women with PCOS can help optimize their health and prevent further complications. So just to recap some lifestyle choices that may help you manage your PCOS better will be to take your medications on time and as prescribed by your doctor, just as Josiah mentioned. The second thing would be to try your best to follow a healthy diet as advised by a dietitian. And I'm not just saying this because I am a dietitian, but for instance, if you and your friend has PCOS and she goes to a dietitian to get a healthy meal plan, what would work for her would not necessarily work for you. So therefore, you should not follow the same plan. So I just want to throw that out there. And the third point would obviously be to engage in physical activity to maintain that healthy body weight. So in closing, and having said that, I would just like to say thank you all for watching. And be sure to like, share, and subscribe to the alumni page for more information.
Thanks for having me here. It was really a privilege to be here and to contribute to the legacy of Waterloo Secondary School, a school that played an important role in my development and upbringing as a professional. And just thanks for being here. And I just want to encourage all the women out there with PCOS, know that you are not alone. You are not being demonized or scrutinized by society. We are advancing. We are here to help. We are here to assist. And I really pray that you all really continue to engage us as we engage you. And you'll have a good day.
For more on these informative topics, like Waterloo Secondary School Alumni Association on Facebook and subscribe to Waterloo Secondary Alumni 868 on YouTube. Email admin@wssalumni.org for further information. Be sure to order your commemorative alumni polo as Waterloo Secondary School, formerly Waterloo High School, celebrates its 20th anniversary this year.